started firstly with the school, because the affected parent had children or has children that are coming from the school. So we wanted to come and engage with the parents so that they understand what are the protocols, but also understand, most importantly, that it is not necessary for the school to close down. We don't have to actually cause panic, but the minister will talk to that. As the province and the minister today, we are going to be having a number of engagements. This was the first one. After this, we will be engaging with the staff of the Department of Health. It will be hosted by Grace Hospital. After that, we are going to be engaging with the general practitioners in the private sector, not in the province, but here in this particular district. And after that, we are then, as a province on our own, outside of the minister, are going to be having engagements, and we will be moving forward with those engagements in the rest of the province. You will see that in our midst, we don't have just the minister, we have the MEC for education, MEC Wazimshengu. Next to him, we have the HOD for education in the province, Dr. Nzama. On my right, I have Dr. Sandine Shabalala, who is the HOD or head of department in the Department of Health. And next to him, there's the DTG, Dr. Kumete. Next to Dr. Kumete, we have the team that comes from the National Institute of Communicable Diseases. And next to Dr. Nzama, we have the team that comes from the school, the chairperson of the board in the school, Cowan House, is here. And next to him is the principal and part of the management. So that's who we have with us today, and we are going then to have that engagement. I will then hand over to the minister to talk to us, and then we will field questions.
Thank you very much. Members of the media, we've just concluded a meeting with the parents who have children at Cowan House. We've also had principals from a number of schools in the vicinity. We've also had members of community, public representatives, councillors and others from Parliament. And of course, as you have heard, we are here as a combined team from government, moving from the school board, school management, Department of Education, Department of Health, National Institute of Communicable Diseases, provincial and national department. We came here to have a conversation with the community, particularly with the parents, in the wake of a confirmed case of COVID-19. This was important because we were concerned that misunderstanding, misinformation, or lack of information does create a challenge and panic, and yet the last thing we want to see when dealing with such a problem of public health concern is the problem of panic and misinformation, and people really worrying without knowing where to get assistance from. We have taken the parents through the whole history of this COVID-19 infection and given a sense of what happened in the whole world, and also how the WHO has responded and how we as South Africa have also responded. We have also indicated that there is an interministerial committee that reports to President Ramaphosa on what it is we need to do. It has dealt with various other outbreaks, H1N1, SARS and Ebola and other hemorrhagic fevers. It's a structured government interdepartmental committee of ministers and senior officials in these particular departments. These to immediately get government to swing into action should we find a case of health emergency of public concern. And therefore, in this case, this team, we call it NIMORT. It has been active and has been meeting for a number of times. And as soon as the World Health Organization declared coronavirus as a matter of public health emergency of international concern, we were all therefore obliged to activate our own systems to stand ready to respond when such a virus is spotted in our shores. And in this case, we have for the past 2 to 3 months not had a case in South Africa. For the first time yesterday, we recorded one patient that has been confirmed, and we want to say we had been on the lookout and we had heightened our sense of surveillance over our shores and our ports of entry, just to be able to spot any of these viruses, of these cases, if anybody contracted the virus, so that we can act immediately. Similarly, in this case, we have found that public sector and private sector is all coordinated and aligned, and so we would assure the public that we'll pick up the case irrespective of whether someone presented in the public sector or in the private sector. Our clinicians, our doctors, our nurses, our staff, both on the public and private side, are well informed to be able to respond and deal with the case as per guidelines. We want to commend the doctor that referred the patient to us, because she did everything as expected in terms of our protocol, diagnosed the patient, what we call high index of suspicion, and therefore did the examinations and sent the specimen for testing, and in the process advised the patient to voluntarily go on a quarantine. That's what we do ordinarily, and this is in terms of the guidelines, and so this is what happened. Yesterday, we did not divulge a lot of information about the patient, other than to say he was a 38-year-old person. We want to start by firstly correcting the error in the travel plan that we reported yesterday. In fact, the patient had come from Italy via Dubai, and then through Emirates landed in King Shaka Airport. So because we have been dealing with a number of cases, we just want to make sure that that is corrected. We have been looking at patients or at passengers who have come from various ports of entry, and we've really been recording each one's history to make sure that we follow if there is any situation where we need to do follow-up activities around that particular individual. In this case, this is a family member who has got a wife and children at home. When he came into the country, he did not have any symptoms and any fever. So at our port of entry, there was nothing untoward that was recorded about this particular individual. And it was this was on the 1st of March, and then a few days later, on the 3rd, developed symptoms and then went to consult a doctor, and then the doctor has acted. In terms of the management, the case management, in this case, there's been quite a rapid response, which we are very, very grateful to our teams for being able to display the vigilance in the way that they have. And so the yesterday, we had then activated our system such that the person was taken to Gray's Hospital for hospitalization. I know that the media has been bombarding us with fake news and questions about patients being in different hospitals. Let's just confirm to you that there's only one patient. It's the first ever to be confirmed of a South African inside the country, or of anyone inside South Africa. There is no other patient that would be in any other place. I know this because before the public knows, by rule, I have to be the one who has to be informed, and then, as I did yesterday, then brief President and the members of Cabinet before we move out into the public. So any of the stories that refer to cases that are in Limpopo University is fake, Grooteskier, Tygerberg, it's fake, and Addington Hospital, all of that is fake news. And I'd like to request our people to desist from spreading fake news. And I've seen others, some of the reporters boldly display a story where they don't have formal confirmation from government. And I don't understand why people should feel free to just spread wrong information, cause panic when they've not even checked it. So in this case, we are dealing with an instance where this case has been properly confirmed. And in fact, Italy is amongst the countries that have really been involved with a lot of infection. I indicated to the parents that the last I counted, in 3 days from the end of February towards the 1st or 2nd of February, we had counted about 16, 17 countries today that were infected by people who had contact with Italy. It's a matter of concern to us. We're also watching other countries that have got similar contact and create such challenges. When we come back to this particular instance, the family has been visited by a team of our environmentalists, our epidemiologists, and all the people who are trained on contact tracing. And we have explained to the parents and community here that the approach is that we work in concentric circles of contacts. The first at the center is the person who is having symptoms that get tested. And everyone who comes into contact with person in the past few days becomes a part of the contacts. And so until that person is testing positive, we observe those who are in the immediate ring outside the individual. As soon as that person is confirmed positive, we then target all of those who were close contacts for testing and surveillance, as well as also encouraging them on a voluntary quarantine. And depending on the severity of the outbreak, we might actually take them out of the area and put them somewhere else because of the nature of the circumstances under which they would have been infected. So in this case, we will have the family tested. Already that work has already been done. The closest of the contacts would then be those who are part of that household. And then I will not speculate further other than to say we do create a very tight web network of all the contacts on a day-to-day basis, targeting those who could have been in contact with the patient at the time that they could have been infected. So it will extend to those who were part of the vicinity of the individual during that flight that came from Dubai. And again, it's not to cause panic, it's just to say we would encourage them to come forward so we can just work together, just make sure that we screen them and that they are tested. And this must be treated as a matter of public concern and a sense of responsibility to come forward and disclose if you are part of that so that we can quickly check. We don't expect that every one person who's infected with the virus will be infective to everyone who come across them, because the form of infection is what we call droplet infection. It's got a limited distance to which the droplet from the fluids coming from the mouth through sneezing, through would actually reach someone who's beyond 1.5 meters away. And so because of that, we tend to then be very scientific and limit the exposure to the immediate contacts. And then once those are tested, if they're all negative, then of course we all go home without any worries. If we find any one of them who's positive, we then take that one into the center, and then we recreate the concentric ring again around them of the immediate contacts. We want to put it very clearly that it's the contact of the person who's tested positive that we get concerned about. But contacts of contacts are not our immediate concern, because scientifically it is not possible to spread to all of those unless their contact was himself or herself already infected. So that is what message we're trying to bring to the community around here. And the issue is that we need our communities to work with us as we deal with this problem. We just want you to know that our team of surveillance is very attentive and vigilant, so we will always move around to move to the people who need to be given the attention and testing and so on. It's a very thorough process. We have here with us our team from NICD and the whole team that is part of this response. Where in this case, therefore, we have asked that the school need not be closed and that the parents need not panic. And also we accept that there would have been kids who would have had flu-like symptoms before this incident. We can just get them checked, but looking at the way this instance has evolved, it's very much unlikely that there would be someone who would display symptoms outside the contacts that were immediately in contact with this particular individual. So we just need to check that, because we now need to be very certain about it. So we then will not be testing any of the children in the school. We will also not be closing the school. We also recommend that parents must just have a high level of observation, so that if there's anyone they are concerned with, we can consult the medical teams and deal with it. Having said so, we also are assured that the province is very well ready to deal with this particular individual. In this case, our reports are that the patient is not very sick, actually. And ordinarily, you could even have treated such a person outside home, were it not because we're dealing with this new novel coronavirus. So we've taken the patient to hospital. But what would happen to the patient? The people in the hospital are already well kitted with what we call protective gear, protective clothing, so that no fluids, no droplets will actually enter the patient, the body of the health worker, and then they look after the patient. If the patient is treated and gets better, that patient will be free to go home. That will be the end of quarantine and any form of isolation. Now that's different to those who are in the house. Those who are at home, we will get the team to go and look at them and just be sure that we are happy with the level of their isolation where they are. Where do they get their daily groceries, and where do they go? So the children mustn't go to school, people must not go to work, and so on. But in that process, if we are concerned that there might be a risk of anyone else being affected, we will then take them out into another place where they would have to be quarantined. This is only one case, so it's not the same as in Wuhan, Hebei, and so on. So we're looking at it very scientifically from that kind of perspective. Guidelines from WHO are very good because they give us a sense of all of that. In this case, therefore, the Department of Health, today we will be addressing the staff just to make sure that they understand that this is a normal treatment of people, just needs higher level of protection, and therefore if more people come, they must not panic, they must not fear, and that there is a way of ensuring that there is no risk to the staff in this case. If we are aware of the patient, the risk to the staff is actually much less. So we're going to be assuring them of that, and the department, as we speak today, is already working quite hard with these teams to look at all these contacts that are going to be traced. Let me leave that issue at that point in terms of how we're going to deal with this one. And just make a plea to all South Africans that this issue of coronavirus, as a matter of emergency, government is in a position to deal with it. We need everyone to take the basic precautions where we make sure that we wash our hands frequently, and that we block our mouths with tissues or handkerchief when we cough or sneeze, and therefore make sure that we keep a distance. If somebody's coughing, you need to keep a distance about 1.5 meters away, and so on. Otherwise, we're also encouraging people to frequently wash hands. If you are in a health setting, we keep more of what we call the disinfectants nearby so that people can keep cleaning their hands and so on. When somebody's been to the bathroom, somebody's been doing something, please make sure that your hands are washed and clean. That's the basics. And secondly, we must stop spreading fake news that either ridicule the efforts of the health workers or that frighten people or send stories around. You get voice notes of people who now are experts on coronavirus. They tell you that a coronavirus has been confirmed in their village, and others, they've got a coronavirus that's been confirmed by their friends on WhatsApp. All of those kinds of things are not helping South Africa. We are saying that the people that we came to meet are actually going to constitute the response of South Africans to the coronavirus infection. Whether we are able to contain it depends on the community in South Africa, particularly in this area where the case has been spotted. If it's spotted in any other part of the country, we need those communities to be well informed so that they do not panic in the wrong way and end up, causing more problems for ourselves. That is the main issue. The President has called and appealed for all of us to have calm, and so we need to be able to do that. I'm very pleased here because I've actually had a discussion with the Premier of the province and MECs. They will be taking forward the information campaign to meet various stakeholders so that people don't feel that they are alone. I said to the parents that it's actually totally understandable for parents to feel that they will be anxious. If it is your child, you don't want your child to be put into harm. Therefore, the parents do have to be concerned, but in the process of being concerned, please be aware you are not alone. We are all together in this, and the best way government can fight the spread of coronavirus is an alert community that responds to the guidelines, that works together, that is united, that is able to spot the problems, deal with it, that will not stigmatize those who are infected. We must never allow a situation where children start pointing at another child and say, don't play with that child, he's coming from quarantine. Don't play with that child because the mother has been tested for coronavirus. Don't play with that child because their school was closed because of coronavirus. It will be most destructive. In fact, coronavirus doesn't stand to destroy South Africans, but fake news, disinformation, stigma, and a lack of cooperation and disunity, that's what's going to cause a problem. So we have been very pleased with the response of the community here. Everyone has been able to raise the concerns that they've got. These are normal concerns that we must keep sharing every day. And therefore, we've been able to clarify a lot of issues amongst them. I want to then say to the media, there's been a lot of support and cooperation from most sectors of the media. Please keep up that good work because South Africa depends on correct information coming from you. We also want to request you, we have got enough experts, clinicians, we have got virologists, we have got epidemiologists, we have got all different specialists that are open to come and give you information. Use them so that we don't use people who are going to become here as fearmongers and spreading wrong information. So we have also heard rumors that there might be other people who are infected, who are in contact with this particular individual. We're actually going to detail. So I can give you an example. Yesterday, we had a story that someone in this area was also having serious symptoms. So we went and called the doctor. I was saying to the parents, I got my report around 12:30 last night, and the doctor took us through the details of the presentation of this individual and also the contacts around the individual. We're satisfied that doesn't constitute a suspected case. Who's got symptoms that we must go for screening, check them up, and just be sure that they don't have coronavirus. If they do have, we'll follow it up and see what is the problem. So anywhere there's suspicion, somebody called and said there's a patient in Addington, or some people were saying, oh yeah, we've got this patient. We don't have. What we've got are people who are sick all over, and we must just, if we're concerned, let's make sure that the authorities take the necessary precautions, that the clinicians, the doctors, the nurses examine them, and then they follow them the right way. The other story that's been making news, again, has been the story of a mutiny in the Defense Force. They will not fly to China. Again, because media has got protection of not having to divulge their sources, we can't even know where they would have got such a story. We're not aware of it. I've spoken to the Chief of Defense, I've spoken to the Surgeon General, I've spoken to the Minister. Everybody dismisses it as lies. And in this case, our plans to get our people from Wuhan are still on course. We did say it's going to take us 7 to 10 days. We're working through that because there are lots of supply chain issues, contractual obligations, details of flight arrangements, the plans of getting permissions, and all of those issues. You need to really make sure that these things are impeccable and people will go out there and then fetch the team. The Defense Force will conduct this evacuation, is their mandate, and the quarantine is going to be handled through the Department of Health as well as South African Military Health Services. All of those issues are on course. We were asking South Africans to be brought back, not because we were unhappy with the way China has treated coronavirus. In fact, China has been the best. 80,000 cases, 53,000 have recovered. 30,000 are still on treatment. In the next few weeks, China will have a minimal number of people who are coronavirus. In addition, we have seen that the numbers of new infections in China is reducing. The numbers of deaths are also reducing. We're seeing that other countries have got an increase in the numbers of new infections and numbers of deaths. We'll observe that. We want to be, as South Africa, amongst the countries where we'll discover the cases of coronavirus, contain them, make sure that the people recover, and limit the spread. We don't want to see any of the South Africans' lives being lost of coronavirus because we've seen that it can be treated somewhere else. We also want to reduce the numbers of people who, when the infection is spotted, must also be affected by it. We are determined to do that. We want to make sure that South Africa is amongst countries like Vietnam, where there are 16 cases reported and all of them recovered and they're done with it. Like Nepal, where they had one case and they treated that person, then didn't have any new cases. Like Iceland, same thing. There are a few other countries that have done a good job, and we keep monitoring every day how many are recovering in a particular area. In South Africa, we're asking that if South Africans work together, we'll get someone with a coronavirus testing positive, we'll contain it within that individual or the immediate people who might be affected, treat them all, get them to recover, look for the next one. When the next one comes, we do the same. Discover the individual, treat the person, don't stigmatize anyone, make sure that the virus is stamped out. The truth of the matter, no country can ever stop coronavirus from reaching its shores. And it is not the failure of our health system. Some of the people have said to us, well, your health system is full of challenges. And we say, yes. It's overcrowded, yes. There are long queues, yes. Yes, all of those issues we are attending to. But we're dealing with an emergency here. To deal with that emergency, we don't have to quibble about the weaknesses of our system. We've got our strength. That is more important than our weaknesses. That's going to help to make sure that we can contain this virus. We can do it as South Africans working together. We have said to the team of parents of the community here that the team South Africa that's going to fight coronavirus starts here. It is those communities, it is those parents, it's those children, it's the health workers, it's the officials in different government departments, it's the media, it's the public, it's South Africans all over that must make sure we defeat this coronavirus. We have seen a number of epidemics, and I was giving them an example. In this country, we have dealt with a number of them. When we were to deal with an outbreak of malaria, we were able to contain it and reduce it quite drastically. When we dealt with cholera, we dealt exactly the same way. We had to deal with listeriosis. We had to also deal with the issues of Ebola. Wherever they happened, we were there as South Africa, we were ready. So for the outbreak, we are ready. When it gets to a point where it is so high, we can then start worrying about the new resources that are needed and whether we need to create new facilities, infrastructure. We're not there yet. We only just confirmed the first and the one case. In 2 months, we're one of the few countries that have done that. 86 countries today have got this coronavirus, but we are amongst the last ones. We're simply saying South Africans can face this and deal with it, and therefore the message to everyone is that we can fight this, we can fight it together. Going into the future, when coronavirus becomes endemic in this country and other countries, we'll obviously need to build in new systems and resilience and probably new resources, new approaches. Maybe by then there'll be vaccines, maybe by then there'll be other interventions. We hope that scientific researchers will be able to help us at that point. But we are saying it is possible to contain this virus. The fact that we have been able to meet with the parents, everyone who's positive here, does mean that in fact sitting here as South Africans, we can actually spot the infection and deal with it. So we are on the lookout. We're not recommending closing of schools, cancelling of matches, and so on. We need to talk to the churches, we need to talk to sporting bodies, and all of that, and consult what can we do, what should we do into the future. But right now, we just want to say South Africa has only confirmed one case. And that one case, we are on top of the situation. The people who are coming from Wuhan, none of them have been tested positive. None of them are sick. We don't expect that should increase the risk. So these stories that are going all around for people to panic, that must come to an end. It's important for us to be able to say we can deal with this problem if we work together. It is not because we are weaker that we will have a case into South Africa. It will be because we are part of the world, but we will be able to deal with it. I also therefore want to ask my colleagues here to make comment, particularly from the Department of Education, so that they can also give you their perspective. Thank you very much.
Well, I thank the Minister. Good afternoon to the members of the meeting. The Minister has already indicated that as it stands, we see no need, and actually there is no need for closing down schools on the basis of this one confirmed case of coronavirus. We will even beyond the meeting today, just to discourage any form of panic, but also of attempts to seek to close schools at slightest suspicion. Because as far as we have been advised, we are not at the stage of an outbreak. So really there is no need for us to close down our schools. Where there are cases or suspected cases, we'll deal with them on those bases rather than taking a blanket approach. So if there is suspicion of an infected child in one school, working together with the Department of Health and all other involved authorities, we should be able to deal with that case on its merits, as it were. Colleagues will remember that last time, or sometime last year, there was a reported case or a suspicion of H1N1 in one of our schools around North. And there were a number of calls to close down that school and other schools nearby. We worked with the Department of Health to deal specifically with that case without closing the school, and we arrested the case, as it were. So from the Department of Education, obviously we will keep all our officials, all our offices on high alert in case there are suspected cases in any of our schools. But currently there is no school that will be closed on the basis of this reported case. Our principals will continue to be informed of any developments, and as the Minister has correctly said, we do want to spread the message to all our parents and learners not to stigmatize this virus, such that anyone who is suspected will then be subjected to stigma and victimization. It's not at a level where really we think we should be closing our school, as I indicated earlier on, and we call on parents to also be on high alert, follow all the precautionary measures that were outlined here by the Minister, ensure that all our learners in school regularly also follow the precautionary measures, so that we ensure that we eliminate the slightest possibilities of any further spread, as it were. So that is the message that we have from the Department of Education, and any form of further communication will come from us directly, from the MEC as well as the HOD, so that we also eliminate, Minister, the fake news of this circular or that circular being circulated now calling for the closure of school and all of that. There is no circular that has been issued to close any school in KwaZulu-Natal. Any further information with regard to this will be duly communicated to the public by myself or the head of department. Thanks.
Let's keep the... Do you want to have parents? Anything?
Thank you. Okay, thank you very much, colleagues. I will request you as channel to assist me with the roll call. We'll be taking questions. You introduce yourself by the name and surname, the house you're coming from, and then your question. Thank you. You are object, you are 1, you are 2, you are 3, you are 4, you are 5. Number 5, 6, 7. Looks like everyone wants to ask, but I will start with 1 at the back.
Thank you very much. My name is Simpio Rokanya, and I work for SABC TV News. Minister, the 5 hospitals that have been identified to deal with the coronavirus issue, what actual practical measures have been put in place in those particular hospitals to ensure that if there are any potential cases, the department is able to handle them? Thank you.
is everyone coming from certain countries being screened? How is this taking place? Because they were concerned about the one case coming through. And secondly, just in terms of how people can be tested, we understand that they have to meet certain criteria to undergo tests. That's what some doctors have told us as well, according to NIC forms. Can you confirm that there are certain criteria that one must have to be tested? Anyone who feels that they have symptoms, go ahead and be tested.
Thank you. Number 3.
Duncan Ghana, independent on Saturday. A follow-up on that previous question. If somebody voluntarily wants to be tested, what is the procedure they should follow? What's the recommendation? What if they wait in a waiting room full of other people, for example? Are there measures that they should abide by to do it safely? And secondly, the helpline. We've been trying the helpline all morning and having difficulty getting through. Rings, and then it goes dead. That is 0800 029 999.
And the phone was somewhere here. Greetings, my name is Koskona Duma. I work for Eyewitness News. So Mr. Richard Virana was here, sent a statement yesterday, shortly after the first case was confirmed. He said that, so this question may be appropriate for the MEC for Health. He said that there is a lack of parliamentary oversight in regard to the 4 treatment centers that are here. Can we get details on that? He also suggested that there was no dedicated budget for equipment and protective gear at these dedicated healthcare centers. So can we just get clarity on that? And perhaps one last question to school officials. And so can we just get clarity, will the school be open then following today's meeting? Thank you.
Number 5. Hi Minister, your team, it's Kavil Singh from News 24. While there has been one person confirmed diagnosed with coronavirus, can you tell us how many people in total have been quarantined that you know about? Thanks.
Okay. 6.
I know you said you don't worry about contacts of a contact, you deal with the main contact. You don't worry much, if I'm not mistaken. But
You didn't put it like that.
Okay.
You said they are contact settles.
Okay.
You first concentrate on the first one, then once it's positive, then you deal with the next one. So there's a delay in there.
Okay. But as a follow-up to that, I wanted to check perhaps from the school, it's a clarity-seeking question really. The children of the said patient come to school this week, or when the parent returned from Italy, did they come to school during the course of the week? And then number 2, are you discouraging South Africans from going to Italy, or for people who come from Italy to come to South Africa? Bearing in mind that most of the cases that have been reported in Africa, most of them emanate from people who have been to Italy. And also, if I were to proceed, I know you have disputed that Wuhan story about members of the SADF not willing to man that aircraft. You say processes are underway, but when exactly do you anticipate that those who are coming from Wuhan will land in South Africa? On the issue of mistrust, don't you think that perhaps most South Africans do not trust the public health care system? That's why they seem to be reluctant in believing what the government says when the government says it's ready for this.
Number 7.
Hi, my name is Sharika. I'm from the Witness newspaper. What I wanted to find out follows up on his question. Will South Africa interfere with international travel? I'm talking about any international travel by South Africans. We've heard, the second question, we've heard that Mount Edgecombe, a state 10, has been under quarantine. Can you comment on that? My next question, how many people so far who has been in contact with this Hilton man has been tested? And how many people have you identified that needs to be tested? And the other question that I wanted to find out, much is said about hygiene, and I'm not so sure if you heard or not, but in Pietermaritzburg, we're running out of hand sanitizers and stuff. My question is, a majority of the people are poor and they can't afford to buy these hand sanitizers and wet wipes. How are they going to prevent themselves from catching this coronavirus?
Okay, we will then take the answers and then we will take the second round and stop. Thank you.
All right. No, thank you very much for those questions. I will respond to a couple of questions that are relating to the province. The first question that was raised by Usimpiwe, I think, was talking to the readiness and what did we do about the facilities that we said are ready. Firstly, there are 4, not 5. There are 4 facilities that are ready. It's Grace Hospital, Ellington Hospital, Design Hospital, and Manguzi Hospital. We have had to go to all these 4 facilities to ensure that their isolation wards are wards that are actually up to standard. And the reason why we have identified the 4 facilities in particular is because at this point, there are the 4 hospitals that did not require us to actually build isolation wards or to have to renovate a whole lot more. So we decided those 4 are sufficient for now. What we have ensured that these facilities actually have, and is what is required, is that the negative pressure aircon is there, and all these 4 hospitals have that. We have made sure that PPE is available to the staff that works there, because if you must protect the health workers that are going to be treating the patients, we then have a responsibility of ensuring that they have the correct protective gear, and we have made sure that the gear is there. One of the equipment that are needed in the isolation wards, yes, that's the gear that the minister is demonstrating now. Some of the equipment that is needed in the wards is something that is called autoclaves. We have had to make sure that that is available in the facilities. However, it's not all the 4 facilities that will have autoclaves. What's important is that the waste management part of it is managed correctly, and there's protocol that is followed, and we've made sure that is done. We've also trained our healthcare workers. We're not just talking about nurses, we are talking about nurses, doctors, ENs, everyone who is there. We've had to train our cleaners, we've had to train the people who are collecting the waste, because remember, the chain is long. It doesn't stop just with your nurses and the doctors. So we have made sure that all the facilities are ready in that regard. The HOD earlier on spoke to other facilities outside of the 4 that we have made sure that are ready for in case there are emergencies, with 2 isolation beds here and 4 isolation beds there. Those we are continuing to prepare to ensure that they are ready. But the ones that we are targeting are the 4 facilities that I have spoken to. Let me then respond also to the question about what MPL, the Honorable Veran, raised about the lack of parliamentary oversight. I think this is a question that the chairperson of the portfolio committee is going to have to respond to. But from where we are sitting as a Department of Health, we do not believe that there is a lack of oversight, because while we were busy with our own processes in the province of KwaZulu-Natal, the portfolio committee itself had started going around the facilities that we were talking to, and they were monitoring that all the items that we say are ready are actually there. They were talking to the staff to indicate or to try and establish whether we have properly trained the staff as we say we are training them. So we don't believe that there is lack of parliamentary oversight, but I think this is a matter that the committee themselves will have to engage. I hope Dr. Viran was not playing politics in this matter, because we have had an engagement amongst ourselves, and we've agreed that this is not a matter that we need to politic about. It's really something that we all need to be hands-on and be able to deal with properly. But the chairperson, and I'm sure you are aware who is the chairperson of the Health Portfolio Committee, is the one who can be able to assist in that regard. Do we have a budget and do we have the equipment in relation to this matter? Of course, there was no budget that had been set aside to say this is a budget that is meant for COVID-19, because it's only something that came after we appropriated our budget. However, Once you have challenges like this, and as management, we have to sit down, well, myself and management, we have to sit down and say, how do we reprioritize within the budgets that we have? We've done that. So we are ready. The PPE is something that the department would ordinarily buy, order and keep in stock, but we would not keep in stock in large volumes. But we've now had to be proactive and actually buy the PPE. So we have put aside the budget. We have had to reprioritize, which is within our own mandate, and we've done that. So in as much as it might affect some of our programs, but we do not believe that it will affect this program and this plan that we have currently. The last point and the last question that I think I want to talk to, although the minister and the team I think will speak to how many other people are in quarantine. There's a question that says in Hillcrest or in eThekwini, there is a group, Mount Edgecombe, yes. There is a person that has been, no, actually you said Mount Edgecombe is quarantined, but no, there is one person. What the minister was talking to is that the contacts of the people who's positive, like he said, it's the inner circle, are all rounded up. At this point, we've established that there are 18 close contacts to that person, and all of the 18 have been spoken to, all of the 18 have been tested as of last night and this morning, and have been all requested to self-quarantine while we are waiting for the results. So that person in Mount Edgecombe falls within the group of the 18 that we've been in touch with as the Department of Health. Okay.
Around the criteria for testing and the procedure for testing. The NIC publishes a case definition which includes symptoms.
That's Dr. Kerrigan McCarthy from the NICD, National Institute for Communicable Diseases.
Criteria include symptoms, and so that's a fever, a dry cough, plus travel history within the last 14 days to an area where there is community transmission, and that list is updated regularly on the website. More recently, last year, we added to the case definition pneumonia of uncertain cause. So if an individual presents with serious pneumonia or critical care pneumonia, there may be an indication for testing for COVID disease. And then in addition to this, we will commence either early next week or from the 1st of April, depending on when we can arrange the reagents for the testing, to include coronavirus disease in our panel of tests that we perform on surveillance testing. So we have a number of surveillance programs looking at severe acute respiratory illness and influenza-like illness. These are amongst outpatients and severe illness amongst inpatients. We have what we call sentinel site surveillance programs, either at public and private hospitals or at GP practices or primary healthcare clinics, where clinicians select patients who meet these criteria and then submit specimens for testing. With regard to the question, can anyone just walk in and test? A person would have to meet the case definition in order to test, and therefore they have to undergo a process of evaluation by a healthcare practitioner. So testing cannot be done randomly. There's a good reason for that. During outbreaks like this, there's often the phenomenon of the worried well, where people develop mild symptoms and they may not have travelled, and then they are concerned and then want to undergo testing. And this, of course, would use up resources, use up test kits for people who may want them and need them better. So we are also in a continual process of revising the case definition in keeping with the international trends and also with local surveillance patterns. So should, for example, we, and let us hope not, but we find community cases,
in a certain area, we may then broaden the case testing to include that. Thank you for the comment around the NICD helpline. I know that our helpline is utterly swamped with calls, so I would ask the public to be patient. We are in the process of employing and contracting an agency to support us on this. Thank you.
No, that next to.
Come close.
With regards to the two questions with regards to the school, Cowan House is an independent school, so I think we need to consider two things. So it will make its decision for itself. However, having said that, I think we need to understand that this all happened at between 3 and 4 o'clock yesterday afternoon. So Cowan House took a decision which erred on the side of caution. In and around the time that was happening, we were in discussion with NICD, and they, without doubt, cautioned us that we were being incredibly cautious, and it wasn't necessary to close the school. Whether in fact we will continue to have the school closed, we will engage with NICD, and we will make an informed decision. We have a careful task team, we have medical people within that task team, and we will make a decision over the next few days as more information comes to light. With regards to the children coming to school, Dad came into the country on Sunday, and the children attended school on Monday and Tuesday. Both children have been confirmed by NICD as well as medical practitioners that they are asymptomatic and always have been asymptomatic. They don't have the symptoms. Dad went for went to the doctor on Tuesday, and on Tuesday when they were then removed from the school, his results came out on Wednesday, and that's when we acted like we did.
There was a question about when do people come back from Wuhan. On Sunday, I did a press conference. I said the planning team of ministers had given them 7 to 10 days. We get asked the question even before the end of the first 7 days. They will be coming back. We'll announce when they are back, that they are. So I don't think we should get too worried now. The problem is, very soon you're going to want to ask, when is such an agreement going to be signed? When is, I think, give us a space. 8 days we said. We started counting from Sunday. That is Sunday, after Sunday we started counting, so they will be coming back. The issue around the testing at the airports, this approach is basically guided by international norms and WHO guidelines. So we are focusing on the areas where there's a higher load of the infection that has been detected, and so we tend to ask pointed questions. We do rely on self-disclosure, and that's the first way of elimination of any symptoms, is to ask the patients if they do have those symptoms. And exposure in the same way. We think that people are going to be giving us information that will help us to decide whether they need to be tested or not. On most of the times, everyone who comes from the airport, who comes into the airport, we actually will ask them questions. We'll also look at whether they look sick, and we test their temperatures. If we think the temperatures are abnormal, we then take that process forward and get them to be examined in the airport by the Port Health authorities. So that approach remains standard. The the number of ports of entry that were to reinforce and give additional information to and give additional gadgets, and so we are monitoring all of those. The disturbance happened in one of the airports in the Beit Bridge area. We already had reinforced it beyond port health staff with military health services, and therefore we are just doing a reconciliation to see if there are very many people who would have been affected. What we believe was a major issue, there was largely the delay in the entrance of people. But we are going into that matter. We did take action on those officials, and we want to send a message as well. And we hear this is a matter of public health and safety concern, and so would like our officials to act as guided, that people should not disturb the screening process, because it's got very serious implications to the public. So that those processes in the various airports will continue. We have not called for any cancellation of any trips. We have not called for any airlines to be grounded. We have not called for any visit to a particular area to be banned. We need to take our own precautions, because if you look, there are many countries who actually stopped aircrafts from flying into China. They've got their own infections still going on now. I think we need to probably try and look at additional means of screening and also investing in the awareness of our communities, so that people can know that they are part of the process of discovering new infections, preventing new infections, testing for new infections, and even participate in the treatment and elimination of the virus as a problem. So we would say from where we sit, those precautions are fairly balanced precautions based on the WHO standards, and they will be in place. There's no decision to be drastic and stop major activities, as it were. Obviously, when you want to take such decisions, it's usually if it's associated with an immediate outbreak where we can see the impact of those particular meetings as being detrimental to the safety of the public. At the moment, we don't have that situation. I know that we have to answer questions and so on, but sometimes we get asked a question when we've got no cases, though we've got as many cases as in China. I think it's a bit of a challenge when we put on the table, this is our plan, and then the questions are, well, people, we don't believe you. What is the basis on which you don't believe us? We have to actually start asking to say, if you are going to be questioning things we raise on the basis of a source that's not disclosed, you actually have to also produce evidence for it, so that you can really argue on a basis of equal levels of information. That makes it easier for us to know how to correct some of the situation. But because people are free to communicate, we always try and attend to issues where information is available to the media and we do not have that information. So we will check it where we're asked. But I think it must be on the basis that we're trying to correct, or trying to inform, or trying to make sure that we are all in touch with the reality. And in that case, we need to then be able to say that we should discourage anyone who just wants to be negative for the sake of it. We must deal with the concerns at the base of which people are saying they are not comfortable. The reason why people might be having challenges with the health system, we have acknowledged, and we're saying that those problems are there. And those problems do not mean, though, that we can't deal with the coronavirus. We have a specific focus on dealing with an emergency. In the long term, if the coronavirus becomes endemic, then of course we need to look at how we need to deal with it as South Africans. But it's no longer a question of government alone. It's a question of the whole society gearing up to that. So let's not spread fear for the fear of the unknown. We don't yet have 2,000 or 10,000 or 80,000 cases. We have just got one confirmed. Let's work together to contain those that are being discovered in the country. That's really what our plea would be. Thank you.
Thank you very much. If there's no one who will die if I don't take questions, I would like us to close. But I can take 2 questions if there's still someone who wants to follow up. Okay, only 2. Thank you.
I know this is an ongoing process, but roughly in South Africa, how many people have been tested? And I know statistics may not...
Over 300.
Thank you.
Michelle Sugal from East Coast Radio.
And by the way, they're all negative except this one.
Minister, just from being in the area today and speaking to people, there were 2 ladies who spoke to us regarding their family members being in the surgery on the day the man was there. What would you have to say to them? They told me that they've been trying the hotline and it's stressing them out because they're not getting through to anyone. And one said that they saw someone who looked like a racist man, but what are the odds of that? So they were there on Tuesday when he went in there. Should they be worried? Should they be contacting you? What should they do?
You know, let me tell you a bit of a story. Many years ago, when I was trained as a medical student, we were trained about cancer of the esophagus. It was said that you would have difficulty in swallowing, you would have a pain on your esophagus, etc., etc. The following day, were a number of students who had those symptoms. Now, the human nature makes people always worry about the worst that can happen. So it's not abnormal when people are worried about that. It's normal. So what we're going to request you to do, give the contacts to this team. We're going to actually tell our tracer team to contact them. Let's just be sure that it is possible to find out if they need to be in the contact list or not. I think anyone who is concerned because they say they couldn't phone through, that's fine, now they found you, it's okay. You will then just give them these details. Anyone who's concerned, we mustn't dismiss it. We will not do that. It would be irresponsible if someone is concerned and you don't sit down and find out why. Because we rely on disclosure. Anyone must first be worried. If they're worried, then we want to know why. Then we must assure them having eliminated the possibility. So any one of you who would have come across someone who says, oh, I was in such a place and so on, just refer them to us because we will then try and help them through. Don't feel, there's nothing serious here, there's no crime committed. All we want is to make sure that we maximize the chance of them being tested, but we don't just test anyone. We have to first check what's happened. Most likely what we'll do here, we will keep them on the list and test the immediate contacts. If we find someone that is again now positive at that level, we then move on to that lot. So we'll just need to assess the proximity with this particular individual. The doctor is going to be able to give us a list of people and their arrival times and who was there at that point and so on and so on. The receptionist will also tell us who was sitting there, who was doing what. We'll be able to eliminate those. There are those who will come in the morning, and there are those who will come in the evening. But the patient was not disclosed to anyone that this one we're going to test for coronavirus. So no one could have ever predicted, because everyone who goes there is sick. So the concern is a natural concern that we must not underestimate, but let's get that into our process. And then I want to give it as an open invitation for any one of you, because people will call you and complain that they were not able to get through to so and so and so and so. Don't take it badly. Just pass the information. We will actually try and link up with them, and we deal with a lot of those. So don't feel uncomfortable at all, because we also rely on you to pick up stuff that we don't pick up as a department. So we'll use that as another channel. So feel free to just share that information. We'll also follow them up.
Thank you very much. With those words, I would like to thank you all for coming, and I hope the message is clear that we all have the role to play. We are all responsible, and we must report responsibly. So thank you very much. The meeting is adjourned.
Thank you.
It's been longer than I thought. Longer than I thought.
You thought it would be an hour.
Let's keep in touch.
Which one is yours?
Definitely, you have to.
This one.
Let's keep in touch so that.